The Spatz adjustable balloon system offers the first easily adjustable balloon with an attached anchor that provides a safe customized balloon weight loss system. The insertion kit contains the device connected to the pusher with its Y port and wheel, 2 syringes, a cap, and mineral oil. The insertion assembly consists of a guide wire that passes through a pushing catheter and the device. The wheel should be in the closed position, clockwise. Lubricate the lumen with the provided oil. Straighten the catheter curls and advance the guide wire until it enters 1 centimeter into the balloon. Prior to implantation, a standard endoscopy is performed to evaluate for contraindications and to identify the level of the gastroesophageal junction. The extension tube is inserted into the groove of the pusher. The balloon, white inflation valve, and the blue clasp are lubricated. The balloon is passed to the oropharynx and the patient is asked to swallow. Advance until the level of the gastroesophageal junction. An assistant holds the guide wire in place, preventing advancement of the guide wire below the GE junction. With the guide wire immobilized, the endoscopist advances the pusher forward another 40 centimeters. The guide wire is pulled out 5 to 10 centimeters, followed by the pusher. The extension tube will be seen exiting the mouth. The endoscope is reinserted. The distal balloon tip may face proximally or distally. The infusion bag, the large syringe, and the 3-way stopcock are attached to the system. The balloon is inflated until all of the bands are pushed back on the catheter shaft. This may require 500 to 1000 cc's of saline. The completely filled balloon will have no creases and will have a visible thick cap. Once fully inflated, the balloon should be deflated to the desired final volume. We recommend 400 cc's as a starting point, since it can be adjusted upward at a later date. A 4x4 gauze is opened and prepared for securing the white valve outside of the mouth. The endoscope is removed while pulling the extension tube until the white valve exits the mouth. The valve is secured with the gauze. The extension tube is disconnected while holding the white valve tightly. The white cap is connected and closed tightly. The 4x4 gauze is used to gently lower the white valve into the back of the throat. The gauze is unraveled, releasing the valve. The inflation tube will slowly advance back to its position. The procedure is now complete. The balloon volume may be increased or decreased multiple times after the initial implantation. Endoscopy is performed. The valve is captured at its soft white neck and not on the clear inflation tube. The endoscope is removed with the snare and the white valve pulled to the top of the scope. The white valve is grasped tightly, while the cap is twisted off and connected to the extension tube. Do not lose the cap. The extension tube is lowered into the throat until there is no further pulling on the tube. The endoscope is reinserted to ensure that the balloon is in the stomach and the inflation tube is not kinked. Inflate or deflate as desired. The endoscope is removed while pulling the extension tube until the white valve exits the mouth. The extension tube is disconnected while holding the white valve tightly. The white cap is connected and closed tightly. Use a 4x4 gauze to lower the white valve into the back of the throat. The inflation tube will slowly advance back to its position. The procedure is complete. Extraction procedure. A needle catheter is inserted to puncture the balloon, or the balloon may be deflated via the inflation valve, as described in the adjustment section. After the balloon has fully emptied, the blue clasp is captured with a polypectomy snare and pulled to the tip of the endoscope. The endoscope and snared clasp are pulled out slowly and gently while twisting the scope to help it pass the gastroesophageal junction. Hyperextend the neck as you pass the upper esophageal sphincter area. The procedure is complete. The Spatz balloon provides endoscopists with the ability to tailor the balloon volume to exactly suit the requirements of the individual patient. Used in harmony with a professionally supervised program of behavior modification and diet, it can help achieve and maintain the health and aesthetic benefits associated with weight loss.